Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Bone marrow changes in the myelodysplastic syndrome. So it is also known as in short, MDS. So it can lead to the dysplasia of the erythroid series and the myeloid series and the megakaryocytes. So dysplasia of the erythroid series, that includes the megaloblastoid maturation. This is abnormally large erythroid cells. Next comes the nuclear budding abnormalities, and this includes the nucleus with abnormal shape. And then comes the ring sideroblast. So in the ring sideroblast, the erythroblast with stainable iron in the cytoplasm. So dysplasia in the myeloid series. Let's look at the myeloid series. In myeloid series, the neutrophils with a decreased number of secondary granules. And the pseudo-pelt, this is important, pseudo-Pelger-Hute cells. So they are present, the neutrophils with only 2 nuclear lobes. Then comes the dysplasia in the megakaryocytes. So in the dysplasia of the megakaryocytes, it is with a single nuclear lobe, and there is a pawn all megakaryocytes, and these are cells with multiple separate nuclei. And if only one lineage is affected, then it is called a single lineage dysplasia. If multiple, it's called multiple. And in percentage of this ring sideroblast is more than 15%. If it is more than 15%, it is called as a MDS with a ring sideroblast. To learn and grow daily like this, please do subscribe.